Hello everyone, my name is Amanda and welcome to another episode of Mentes y Fronteras. Today we have a super cool topic. We're going to be talking about religion and mental health and how they work together. Today we have a special guest who came all the way from Ohio. We have Jesse Ojeda with us today. He is a third-year clinical psychology student at Bowling Green State University. Thank you, Jesse, for being here today.
Thank you so much for having me.
How was your flight?
Flight was good. Had a bit of a connection in Chicago, but made it close enough. Always takes a minute to get used to the Florida humidity again, but I'm glad to be here.
Yes, we have AC, which is something to be grateful for.
Truly.
But again, thank you for your time and share with us a little bit about yourself. You know, what inspired you to enter a clinical psychology program, which is very rigorous, and you know, what led you to being here today?
Yeah. So I'm an academic and a researcher that focuses primarily on religion and spirituality and their intersections in psychology. So it's a pathway that really stems from growing up around religion. I grew up in a religious tradition with a family that were ministers, and mental health was always a dynamic that was sort of talked about, but had this in and out nature to it. There was a sense where some sections of people within religious faith were more open to it and some were more closed off. And I was interested in navigating the sphere in which mental health and religion had positive interactions and had negative interactions. That came much more, I would say, throughout my college years, which is where I started studying it in more of a rigorous research context, particularly in neuroscience. I actually worked with a team in my undergrad that looked at neurobiological correlates, which is a fancy way of just saying, you know, how do our brain structures and functions differ for individuals who have religious belief or who have spiritual practices. And that really sparked my interest in continuing down a line of research work, which is why I went more towards the clinical psychology route rather than other forms of therapy. But my heart really lies in talking and in hearing people's stories and doing mental health work in that way. So fortunately, I have the ability in my program to develop my clinical skills and have conversations about religion and spirituality with individuals who find that an important part of their lives. Some of my clients, that takes a large precedent, and others it doesn't. And I think some of the beauty of the space that we have as therapists is the ability to hold that. And I think that's something in training for psychology that I like to see talked about more. So I think this is an important topic to have. I think therapists, from the training that they have across levels, whether you're doing clinical psychology, mental health counseling, marriage and family therapy, I think training sites don't necessarily know how to have these conversations, and yet religion and spirituality are huge lenses of people's meaning, of their purpose, of their worldview, their value systems, things that we talk about all the time in the field, but we don't necessarily have these conversations in those spaces in our training as clinicians. So having this conversation, I think, is something that's really inspired me to tread that as a research path, both from understanding these constructs more, but also in having these conversations with individuals who are looking to have them outside of just a spiritual or pastoral context, but also when working through their mental health issues and problems that they bring to us.
For sure. And the importance of research, right? Because it trickles down into the field, right? And science is always changing. And so I'm so glad that you have a passion in that, because we need more individuals doing clinical research for therapy. And like you said, LCSWs, LMHCs, LMTs, we all serve a purpose in holding space for our patients and meeting them where they're at. Right? And like you said, it's been very taboo to have this conversation, especially for me being Hispanic and you as well. I mean, from my experience, it's been very separate, right? And growing up in a home that was predominantly, you know, Catholic or Christian, and they saw things as separate, right? Like, oh, therapy, you know, that's different, right? And maybe you're not praying enough, or you're not going to church enough, or maybe you just don't, your beliefs are not strong, right? And I have learned through my training, and I went to FGC, which I'm super thankful of, because we had a multicultural class and we learned about, you know, various religions, and we'll kind of get into your thesis, right, and what you've been working on. But they taught us how important it is to understand our patients, right? And even if I don't share the same religion as my patient, that does not matter, right? Because I'm there for them, and so I will go ahead and do research, right, on their religion, so I can bring that and integrate it into the counseling process. So can you dive a little bit more into specifically what you've been researching so our listeners can understand a little bit more?
Totally. And I think just to respond a little bit to your own personal background and the intersections there, I think there's stuff to speak to there as well. I feel that, in a podcast that's focused on Hispanic cultural interactions with mental health, I think that's a big question. It's a big conversation to have that's important. I think you highlight two parts of the conversation that I would summarize as there's this cultural dynamic and there's a religious or spiritual dynamic. Because there's a cultural dynamic where, religious and spiritual spaces for individuals from Latine culture, it's huge sources of community, huge individuals or places for individuals to have community interaction, familial interaction. There are ways that, like I mentioned earlier, meaning making and purpose is instilled oftentimes in religious groups through shared practices, shared rituals. And the other cultural nature of that when those individuals come to therapy is that the vast majority of mental health clinicians do not look like them, do not understand their culture, and that's something that I think training programs need to be aware of, especially in this time where we're really having conversations around inclusion, around belonging, around understanding where people are coming from. Spirituality and religion is a huge part of that, and I think the nature for individuals who are experiencing these forms of knowingness and belonging in these religious community settings, they want to have a therapist and a clinician who understands that. Maybe doesn't have to share that, but at least can engage with them on their terms. So I think there's a cultural dynamic where Latine folks really want to come to a therapist who understands their cultural background and what that means, but also their religious or spirituality and their practices that they engage with to maybe not have that be a focus of therapy. There are some who do, and some who are explicit about that wanting to be a part of their therapeutic experience, but others who maybe just want to not have to do all the translation, like of what is this spiritual practice mean, the history that I've come from being in this sort of community for, in some cases, as long as people have been born, as long as they can remember. How that focuses more particularly on my work, like you asked, I'm actually looking at individuals who leave religious traditions. So my particular focus is on individuals who leave evangelicalism and how they cope through that process, whether they turn to their divine figure, whether they call that God, they call that a higher power, whether they turn to their intimate partners or their family members to process that change, or whether they turn to their broader community. There's a light side to that and there's a dark side to that. So there are ways that they engage with either family members, the divine in positive ways where they find support, they find ways that they can engage in conversation and understanding and intimacy. Truly is one of the words that they use in the academic literature for its spiritual intimacy to really understand that process and to have better mental health outcomes down the line as this process goes on. Because religious exit, which is one of the academic terms we use for it, particularly within the evangelical colloquial language usage, it is usually talked about as deconstruction or even different ways of navigating between faith, whether that looks like a full, secular exit of a full disbelief or just a private spirituality that emerges from communal work. But there's a lot of broad ways where people transition between religious spaces and then have to process what that experience is like. In other contexts, you have, and I think evangelicalism is similar to this, but maybe historically more in the academic literature, they talk about what they call high demand groups. So groups in which religious life is infused in all aspects of being, in more insular communities where everyone identifies with the same religion, day-to-day work-life practices and community interactions are all involved with people who share a particular value and faith system, which sometimes can be beneficial when you are agreeing with that and staying with it, but can be hugely detrimental to one's mental health once they leave. But that word may is very important. There are some individuals who may have a strong drop in their mental health when they first experience that loss of choosing to leave their religious space, but over time actually find either new communities, new value systems, new ways to integrate themselves into an environment outside of that religious faith that really actually becomes really protective and much more helpful. We see a lot of post-traumatic growth, or just kind of growth in general from that, even if that isn't a experience that the individual would classify as traumatic. But in other individuals, you see, from that cutoff of family, of community space that they may be so connected for a long time, they really wallow in a severe mental health impact. And what my research is looking to do is, how can we understand what directs that pathway? What may predict why an individual goes from experiencing a really low mental health event after this exit to then a much stronger growth, versus what may actually predict that they stay in a lower mental health space following that exit event. So right now I've kind of had the privilege of looking at both some qualitative and quantitative data in this. So there's a number of measures that we use to explore people's relationship to the divine, explore their relationship with either their parents or their intimate partners, and how they can talk about their spirituality, find either forgiveness from God, forgiveness from their family or partners for choosing to leave, how they can find support through the struggles of navigating community loss. And then also just asking, what are some of the most meaningful things that they feel they might have lost in choosing to leave? So of the, I surveyed about 550 emerging adults around the university where I'm in, and also actually through an online sample that we used for people who identify as religious exiters or exiters of evangelicalism. The most common response was people felt that they lost intimate relationship with community, intimate relationship with family members. So these are things that if we took it out of the religious and spiritual context, us as therapists would say, oh, that is a hugely meaningful event we probably would want to process and talk about, especially for individuals coming from Latina culture, where family oftentimes is a central important value, where people find a lot of purpose and meaning, and having to process that would be something we would easily clock, but sometimes within the religious and spiritual context can get overlooked. So right now I'm trying to, look at this data that we've collected, try and understand a bit more where these trajectories lie. And it's important work, but can be heavy to see the toll that this takes for individuals.
Right, and how you mentioned it could go both ways, right? It could be an amazing coping skill for someone to become integrated in, a religious community, especially if they're struggling with isolation, depression, right? Anxiety. And a lot of these religious organizations, offer community work, right? And volunteering and events. And that can be very positive for a person's mental health, right? But if they decide maybe, this religion doesn't align with my values anymore, right? Or I've experienced a lot of hurt and trauma, right? Religious trauma is very common. And making that decision, leads to grief and loss, right? They're not only grieving the community, but like you said, they may be struggling with guilt or shame for making that decision. And we just can't ignore that in the therapy room.
Yeah, I feel like also individuals who might be understanding their own identity. We see a lot of religious exit happening amongst individuals of emerging adulthood age. So you have people who are either, graduating high school, going off to college, starting their first jobs, and really finding themselves as they normally would, and finding that new person doesn't really comport with maybe some of the traditions of the religion they came from, and then having to navigate what does it mean to find myself, find how I understand myself through a different identifier, which sometimes oftentimes when it integrates well, can actually be really wonderful for their mental health, especially if they're coming from a religious environment that might be toxic. There are some that are abusive, coercive. So having to understand also the quality of what that religious interaction is for them, in some ways can also be very predictive and helpful for understanding where their mental health might go after exit.
Mm-hmm. What would you say to, maybe there's a listener, tuning into this episode, and they belong to a religious community and they enjoy it, right? But they're curious about therapy, and they're apprehensive because they're just not sure if that would maybe devalue that spiritual component, right, or that religious component. What would you say to that person?
What I would say to that person is I like to view our health in three parts. There's our physical health, there's our emotional mental health, and there's our spiritual health. And I do truly believe those all need to be fully integrated for us to really experience the true flourishing. And I think, in some other conversations that we've had, that whether from religious tradition or just general cultural stigma, there's a real viewpoint of concern around mental health, around whether people are concerned whether they'll be viewed as crazy, whether others will see them as really not well because of the struggles they might be experiencing. And I think the things I would say to individuals who are trying to hold their mental and spiritual health together is that I think that both mental health clinicians are becoming more prepared to operate in that way and to do that. I think that those are conversations that need to be had in order to find that integration. And I think there is different forms of care individuals can seek based on how comfortable they are. I think a really important thing is for members of the clergy from any religious tradition to know where pastoral care has its limits, because I do think there is an important nature to pastoral care, but there's also an important line to know when that needs to be referred out to someone with professional mental health care training. And there is interfacing some that is starting between communities in order to facilitate that transfer between both pastoral and therapeutic mental health care. And I think for individuals who are maybe just trying to see how comfortable they feel, being able to pursue which one of those that they feel most comfortable with, I think, but knowing that there is an important nature to their spiritual and mental health that I think individuals and leaders in both contexts, whether from their spiritual lives or their therapeutic care team, would want those integrated and would want to have them to understand them through a lens that sees them as one. So I would encourage them really to try out therapy, try out seeking whoever a spiritual either leader they feel comfortable with. That could also be maybe not a spiritual leader, but just a family member or someone that they share that faith or understanding with. I think there's a lot of power, and research shows us these in a therapeutic context you're familiar with being seen, being understood, having an unconditional and warm positive regard towards somebody that knows that they can either empathize or understand what they're experiencing. So I think even starting there, if that's even step one, I think is one way in which they can start to explore a bit more, how can I find integration between these three parts of my health?
For sure. And something that parallels as an example, right, is, our scope of practice. And like you said, for maybe a pastoral leader, like they have their limits, right? And same thing for therapy. I have my limits. I'm not a psychiatry provider, right? And so I would refer out for a patient that's needing medication management, right? And psychiatry would do the same. So it's no different when you're talking about those different factors of health, right? And I always bring in the wellness wheel in my sessions, and like financial wellness, right? There's that, physical, meeting our basic needs, food, shelter, water, rest, and like you said, spirituality is a part of that. And so as therapy providers, if we are not integrating that, right, then we're missing a really big component for our patients. And so I'm really happy to hear, that you're a part of research and developing these needs that we need in the field. So is there anything else specifically that you wanted to provide to our listeners? Maybe any misconceptions that you have heard as maybe you're doing your research with students or anything like that?
I think I would say maybe a bit more general outside of the research context. I think understanding that religion and spirituality is vast. A lot of us have personal experience with it, and sometimes can only see the boundaries of our personal experience and how we see religion and spirituality, whether that's through a specific tradition we come in, a specific community that we've been a part of. And there's broad understanding of how that can look. There's broad practices of how that can look. I can speak from my own life that in my own faith tradition, it took well into my college years and shortly thereafter to find practices that I found for myself that were really helpful for my own mental well-being, that were much more focused on awareness to a present moment, to spending time in meditation and spaces where I could center and ground myself, which were really actually a part of my religious tradition in a way that I wasn't aware of for quite literally 1,500 years. And I've, in my exploration of other religious traditions, have seen overlap in things that us and therapists would probably say looked very ACT-oriented or very mindfulness, MBSR or MBSR based, and these have also been in conversations around religious traditions with different language or with different sheens on them. And I would really encourage individuals, if they have parts of themselves that they feel are spiritual or religious, whether either or, that they want to integrate in some way into their well-being, that they're in a space where they've decided that it would be better for them to incorporate some aspect of it than leaving it behind, to try and explore outside of the tradition that they're familiar with, to see where people in their faith tradition are having conversations around mental health, around practices that may be very encouraging to their mental well-being and to their day-to-day life, whether that's communal or private and personal. Because I do think that many religious traditions have that within some vein of those who are practicing it. And it's a matter of understanding that in certainly major Western religions, but also beyond that, that there are just broad practices that we can explore to implement that may integrate better with how we view ourselves and view our needs in that time, especially from a mental health care point of view, that sometimes can get lost when we focus so primarily just on the experience or kind of the cultural conversation around religion. Because I think both in the academic research I found, but also just in social media culture or our kind of broader news media, religion is viewed through a very narrow lens. Spirituality is viewed through a very narrow lens. And these are communities, contexts, histories, practices that have rich, rich cultural traditions that are fascinating to explore, whether they are from your own tradition or a different one. And I think giving credence to that and fully understanding the breadth and scope of what that entails means looking outside kind of your own bounds. And I think some individuals, if they're looking for that, will be pleased with what they find, regardless of the religious tradition they come from.
And exactly, and finding a therapist, right? So I do want to touch on that, because for someone who's maybe apprehensive, right, like we discussed earlier, maybe they take that first step and they make the therapy appointment. Ask your therapist, are you comfortable, right, exploring this with me? And you may have a therapist say, no, I'm not, right? Or they don't feel competent, right, in that area. That's okay, then you can try somebody else. Not to get discouraged with the first therapist that you're placed with, right?
Yes.
It's not always going to be a perfect fit, right? And I always say it's like a haircut. We've all had bad haircuts. I got bangs that started back here and I looked like one of the Dolan twins, but I never stopped getting haircuts, right? I tried out a new hairstylist until I found somebody that worked well for me, right? And so I encourage listeners not to just give up on therapy and mental health care with maybe a negative experience, or maybe you went to a provider that didn't integrate, right, the religious component or the spirituality component, whether that's processing religious trauma or trying to integrate it as a coping skill, right? Give it a chance and then advocate, and express your needs to your provider.
Yeah, and I think very practically, as you well know, but for listeners who may not, there are ways you can really actually choose to find that in psychology databases that when you're trying to find a therapist, to see those who are sensitive to your specific religious tradition, to the beliefs that you might be coming with, and also just asking. I think also being very upfront when you're starting out with a therapist to say, what is your familiarity with this belief system or with this sets of practices that are important to me. I think bringing it into the room is really important, and I think starts to remove some of the stigma on both sides of the chair for therapists and especially even academics who trend more irreligious, to be able to have these conversations about these important cultural markers, but also for individuals on the other side of the chair who are nervous to have these conversations with how they might be judged, how they might be viewed, all of the stereotypes and assumptions that come with certain types of religious belief, whether that's based in a particular country, like here in America, or more broadly outside of it. Being able to have those open conversations so that an individual can feel seen by their therapist and understood for this important part of them, should they choose to bring that into the room, which I would encourage them to if it's important to them.
Mm-hmm. And at Elite, one of the cool things about, Elite DNA Behavioral Health is we have so many providers from different backgrounds. They use different types of modalities for treatment, right? And so our hope, right, is when a patient comes in and they do their intake, they can express those needs, right? And like, this is what I'm looking for, and we try our best, right, to match them with a provider. But like you said, having those transparent conversations and saying, are you comfortable, right, helping me with this? And it takes a lot for a patient to say that too, especially if they're hesitant.
Yeah.
So Jesse, can we kind of reroute a little bit? And I want you to expand on religious trauma and what could be some signs that someone may be in a toxic environment.
Of course. So I think this is a really important part of the conversation, because as much as we talk about religion as coping or religion as a central part of someone's worldview or purpose and kind of meaning-making lens, there are also times where people grow up in these environments that are, frankly abusive, as we would talk about in a therapeutic context, that there is a lot of coercion, there is abusive tactics that are used, as you would encounter, and we talk about more colloquially, like in abusive intimate partner violence or other types of relationships. And a lot of times that can be seen from leaderships on their congregations. It can be seen in family dynamics where individuals are coming from families where their parents have unfortunately abusive tendencies towards using religion and holding that over other family members' heads. So I think it's an important part. It's also the research conversation is coming alongside to have more conversations about. Even one of the parts of my study for my thesis is looking at religious and spiritual struggles and how people's conflict either with how they perceive God, how they might receive abusive interactions or conflictual interactions from their intimate partners or from their community members, how that can affect their mental health, how some might be exiled truly or excommunicated from their religious spaces because of parts of their identity or parts of their behavior that they decide they don't want to change and is something that's central to them. So it's a conversation that's important, and I think that fortunately both academics and lay people are coming together to have more understanding of, ask more questions of. I actually have a researcher in my program who's focusing most of her work on religious trauma and is connecting with different organizations and nonprofits that have growing social media presences on sharing stories of religious trauma, of adverse religious experiences, and trying to increase our research knowledge of that. So what I would say to an individual who might be questioning the experience that they're in and seeing if it's abusive, I think in the earlier conversation we had of trying to seek either trusted mental health care resources and discussing their situation with a trusted mental health professional who's trained to see abusive contexts, I think is important, because they can be able to name that in the room, and might be the first time those individuals hear those words used to describe what they might have just thought has been normal their entire life. So I think finding individuals who are trained in that to have those conversations that might be looking for the classical signs of abuse that we talk about overstepping senses of control over somebody else's life, over small parts of their experience, over these very rigid belief systems, over any shared number of the classical markers that we talk about. I think looking for those not just in maybe intimate partner relationships or family relationships, as we're used to talking about in the mental health field, but looking at those in religious contexts, whether it's through their community, through their spiritual leaders, and hopefully going to individuals who understand that and can name that for them, so that you can process that and see to what degree you need to draw boundaries and find protection for yourself when navigating those scenarios or choosing to leave that scenario. Definitely. And again, like you said, any environment can be toxic, right? Any environment has the potential for abuse, right? And so even if the person says, I like my religion, right? Or I like this faith that, I identify with, but maybe the community I'm involved in just isn't right. Yeah. So, anything else before we wrap things up, Jesse, that you feel like we haven't touched on? I think I would say that I really I'm hopeful for where the field is going as a current researcher. I think we're having important conversations around mental health that is reducing stigma. I think I see that both in broader culture. I also see that in the Latina community. I'm seeing important conversations on the spiritual and religious side of caring more about mental health, not just seeing it as a lack of faith or a lack of belief or just a divine trial that you just need to white knuckle through. And seeing more of an integration on how emotional and spiritual health really can be viewed through the same lens. And because I'm seeing that on both sides of the field, I have hope for more conversations being had across those traditions and individuals who find themselves both wanting mental health care and having religious and spiritual belief, being able to find the touch points between those communities, between those subfields to be able to find that integration that we so often desire when we have both of those parts as a part of ourselves. So I think just ending on a note of these conversations are happening in both fields from my own experience and from what I find in my research, and the ability for that to move forward is something that I'm finding is stronger and stronger each day. So I would encourage those listeners who might be in their first experience with trying to mesh these two parts of their lives together, that it's both getting better and there's conversations that are being had that hopefully will start to really normalize this on both sides of the field in months and years to come.
For sure, it doesn't have to be separate. And the last thing I will say, because you brought it up right in the very beginning, I want to tie it back, is we can't control other people's perceptions, right, of our decisions. And so and I hear it from a lot of my patients, my mom is kind of upset I'm here, or maybe I'm afraid to tell dad that I'm, seeing you, right? What are they going to think of me? And as long as it is a value-based decision, right? As long as this aligns with your values and you're making this decision, right, to come to therapy or psychiatry, you want to try it out. You can't control what other people think. And we have to sit with that discomfort and radically accept that sometimes mom and dad may not agree, right? And that's okay. So again, Jesse, thank you so much for being here and sharing your expertise with us.
Yes, thank you so much for having me and for giving space to this really important conversation.